You can tie into your region and the things that bring people to your region, but I think it has more to do with what your patient has access to and what are the things going on in their particular life. Because how I talk to my executive and make plans for how my CEO works exercise into their daily life is very different than my single mom with 4 kids that they're taking care of. Is very different than my 30-year-old single, working woman in a 1-bedroom walk-up apartment who, can't go outside after dark because it's not safe in her neighborhood. And so you have to kind of get to where the patient is, which sometimes takes time, but that's why having, a cadre of various different activities, it's really not one size fits all. You have to tailor it to the person. I think a lot of people don't want surgery, and so it's like if you've got to have surgery to take care of a problem, I see a lot of patients that say, I want to do everything I can not to have surgery. But for some people, the reality is they've tried everything and it's just not happening for them. And for whatever reason that is, whether it's social barriers, whether it's family barriers, whether it's physical barriers, it's really hard to exercise when your knees and your hips and your back hurt. And so if you have an inoperable spine condition that makes it, impossible for you to sit on a bike for more than 5 minutes or walk more than, 20 feet without needing a rest, it's not reasonable to try and tell someone, to lose more weight and their knee arthritis will feel better. They can't do it. And so sometimes with the bariatric surgeries, that's just what people need, but it has to come with a lifestyle modification. And I think a lot of the programs really do sort of vet their patients and let them know, we can do this gastric bypass, but if you don't make the lifestyle changes, you will initially lose weight and then you will gain weight right back. And then you've gone through this whole thing for nothing. It does seem like fitness is, runs in families at times. If you are a parent and you have an active lifestyle and you cook and eat a certain way and your kids are raised that way, usually they'll, kind of follow along until they go to college and then can eat whatever they want and do their own thing. But hopefully you've instilled some healthy lifestyle. And same thing if you're not very healthy with what the choices that you make for yourself, or if you're not educated about the right healthy choices you make for yourself, you don't realize when you're giving kids something that's unhealthy for them. And so I think for parents, it's realizing that the lifestyle choices that you set or the lifestyle decisions that you make as a child, what your parents give you, really affect the way that you lead the rest of your life. So if you were, sort of an overeater or ate bigger portions of unhealthy food as a child, and you think that's normal, then it's going to seem ridiculous for someone to come in and give you these, leaner options and smaller portions. You're going to feel like you're starving to death, even though you're not going to starve to death. It just is, kind of shifting and getting used to your body being able to go on that type of fuel. Fix is a good word. Fix to me means you take something to someone else and they do something to it and then it comes back and it's perfect and it's not broken anymore, doesn't need any more work. Or even if I fix something in my house, if I fix something, I fix it and then it's fixed. There's no fix. It's an ongoing, continuous series of fixes, I think, that needs to happen. And there are very few people who are born obese and stay obese all of their life. It's a series of lifestyle practices and changes, stresses that come down on people, coping strategies that they've developed over time, access to healthy versus unhealthy foods in your vending machine or where you work or where you live. And so all of those things add up, and it takes a good amount of time in order to undo all of those things. And that's the hard thing in our society. It's like immediate access. You need to Google something, look something up, get immediate information. If you want something to eat, you can get it right away. So we're used to having things very quickly, and weight loss doesn't come very quickly. Weight loss comes with time and dedication and struggle. And hopefully a little bit of fun. I mean, that's what you want to be able to actually find the fun. I read a quote somewhere where someone said, a woman who was considerably overweight and then lost a lot of weight, she said, there was no cookie or no piece of cake that tasted as good as thin feels. And so it was, kind of seeing how much improvement you get when you make those lifestyle changes. I think the next step for our physicians is figuring out, you can use some resources. The American College of Sports Medicine has an exercises medicine program that is exactly, tells physicians how to write an exercise prescription and gives tools for the physicians and their patients to follow up on exercise as if it's a prescription for a pill. And the American Heart Association has some great things on their website about how to incorporate physical activity and healthy diet in small steps so that you're not changing your whole life at one time. And so physicians, we need to use those resources to empower our patients to really be able to get access to make those important decisions. I think also as physicians, we need to take a look at what we're doing in our own lives and set an example for our patients. We're very busy. We have families, we have demands, we have chairmen, we have patients, we have administrators who all have demands on our time. And if we're not making the right decisions and we're not setting a healthy example, then our patients are going to look at us and say, that's the pot calling the kettle black, for lack of a better term. So it's hard and it's difficult. And I think sometimes sharing those struggles, the things that you do in your busy life to make it happen, some patients really couldn't care less, but some people will say, the struggle is real. They're not just naturally skinny. It's kind of fighting the misconception that everyone who's thin is just naturally thin, and it happens that way. Certainly there are those lucky people that we all want to strangle, but most people it's an ongoing struggle. And I think for patients, it's really, you've got to be ready to make a change. And sometimes as a physician, it can be a little bit tough to gauge that, to engage your patients, because you can spend 10 minutes of a 15-minute visit talking about it, and if your patient's not ready to hear it, they're not ready to hear it, it's a waste of time. That's why the 30-second tidbit is good. And if you see that that lean forward, or that moment of kind of recognition that I'm ready to do it, then that's when you take the extra time to do it, because that is actually when you're going to make a difference for your patient. When you're starting off on a program or trying to increase the level of activity that you're doing, whether it's running, cycling, dancing, Zumbaing, whatever it is, a lot of people start and then they get very sore or get injured and then they stop, and it's a barrier to their program. And so a guideline that I give people is you should start off with an activity for maybe, if you're already fit, you can probably do an activity for 30 minutes. But if you're coming off the couch, 10 or 15 minutes, that's it. And do not increase your intensity or your duration by more than 10% per week. So if you're starting off and you can run 1.5 miles, that doesn't mean 2 weeks from now you should be running 5 miles. You need to, take your 1.5 miles and turn it into 1 mile and 3/4, and then slowly up to 2 miles, and then slowly up. That's how you're going to avoid injury, and that's how you're going to avoid being horribly sore. You'll still be sore, but that's kind of part of the process.